When we talk about acamprosate, again, as we were discussing, it may also decrease mild anxiety, mood swings, sleep difficulties, which are associated with the protracted withdrawal syndrome, which is observed after first 4 to 5 days of abstinence, which may continue for 3 to 6 months, as we have discussed. So there also we talked about. So sometimes acamprosate has a role in treatment of protracted withdrawal syndrome because it also decreases the withdrawal symptoms. Now let's talk about the dose. Now for a person with a weight more than 60 kgs, now it is basically we have 333 milligram tablets of acamprosate. So 666 milligram, that is 2 tablets of 333 milligram is given thrice daily. So a total of 1998 milligram per day is given. So we give 2, 2, 2. Now also it's important to understand that acamprosate, when a person is having renal impairment, so in a person having moderate renal impairment, that is when the creatinine clearance is between 30 to 50 ml per minute, so we need to decrease the dosing. So then the dose is 333 milligram thrice daily. So then we give 1 tablet TDS. Now again, a very interesting trick I will tell you to understand. So we'll talk about some of the contraindications, some of the diseases in which one has to be careful. Now this trick will apply to all the 3 drugs which we are going to discuss in alcohol, that is acamprosate, naltrexone and disulfiram. So in which of the disorders you have to be careful, or in which of the disorders, if they are having severe problems, we should not give the drug. So again, try to understand this trick, very useful and will be very easy to remember. Now, so either we'll talk about that the drug should not be given in any liver disease or any renal disease, right? Now just see the name. So whenever you see the name of any of these 3 drugs, see first of all whether they are having L or R. So here we know in acamprosate there is a R, so there is no L. So basically in which disease when it is severe it should be not given. So in severe renal condition it should not be given. So similarly we'll talk about other drugs. So even if the drug name has both L and R, just see which is coming first and that will be the answer. Okay, so now when the weight of the person is less than 60 kgs, then the dosage is 1332 milligram daily, that is 333 milligram tablet to 1 1. So we give 4 tablets like this to a person having a weight of less than 60 kgs. Now, the drug should be started after the patient has stopped taking alcohol, and the duration, when we talk about the duration, usually it is seen that the clinicians, they prescribe it for around 6 months. Now, NICE guidelines says that the duration is 6 months or it could be even longer. So patients who perceive benefit and they wish to continue it. Now also importantly, NICE mentions that it should be stopped who continue to drink alcohol for 4 to 6 weeks after starting the drug. So those patients who started the drug, but again for the next 4 to 6 weeks they are continuing taking alcohol, then in those patients you should stop. Now also important is one more guideline we'll talk about as we were discussing. So there is standard treatment guidelines given by Ministry of Health and Family Welfare, Government of India 2017, that recommends that the duration of treatment is 1 year. So again, you should know what various guidelines say about the duration. Now studies have shown that acamprosate shows 15 to 20% better outcome than placebo. So it is again through evidence based medicine we have seen that acamprosate has a good effect or has a good outcome when we compare it to placebo. Now let's talk about some important points. So first is, let's talk about some common side effects with acamprosate. Now GI side effects may be seen with acamprosate such as diarrhea, flatulence, nausea, abdominal pain can occur. Then again headache, backache can also occur. Infection or flu-like syndrome, chills can also be seen. Somnolence, patient may appear drowsy or sleepiness may be seen. Decreased libido can occur. Amnesia and sometimes confusion may also be seen. So these are some of the common side effects associated with acamprosate. Now some serious adverse effects seen are anxiety, depression can occur, and rarely suicidal attempt can occur. Acute renal failure again can occur. Then other conditions such as heart failure, mesenteric arterial occlusion, then cardiomyopathy, deep thrombophlebitis, and even shock can occur. Now, all these three drugs, they are category C in pregnancy. Now, let's talk about precautions. Now, one should be careful when there is a moderate renal impairment, and as we have discussed, one should try to adjust the dose, decrease the dose when the creatinine clearance is between 30 to 50 ml per minute. Also, one should be cautious when there is comorbid depression or suicidality is seen. Again, as we have discussed, rarely it can also lead to suicidal attempt. It can increase depressive symptoms. Now, there is one very important contraindication. Again, as we were talking about that trick, if you apply, so there is an R, that means renal. So it should be it should be avoided. It should not be given in severe renal impairment. That is when the creatinine clearance is less than equal to 30 ml per minute. So again, these are some important points which one should remember for acamprosate. Now also there are certain predictors of favorable response. Again, these predictors you can read from Lowenson and Ruiz. So we're talking about some predictors. So many times when these predictors are present, there is chances of a good response with acamprosate. So again, one should know about these predictors as well. So let's discuss some of these important predictors. So one is, if there is a greater level of anxiety and physiological dependent is more, then the response is better. Also, if there is a negative family history of alcoholism, so there is no family member with a history of alcoholism, late age of onset again is a favorable outcome. So patients having late onset, then you may see that acamprosate has a better response. And in females, again in females, it is showing favorable response. So these are some of the predictors. Many times, these predictors can help you choose between the drugs and also can give a more favorable response than the other drug. Now, let's talk about, so let me just, before starting another drug, let me just give you a simple mnemonic. From the name acamprosate, let's learn some of the important points so that it becomes very easy. When you're writing a question, some of these points can come in your mind. So let's understand now. So acamprosate, A is, we know that it leads to abdominal symptoms, so such as there is flatulence is there, then there is nausea is there. Then C, you can remember category C in pregnancy. Also we talked about that some of the serious adverse effects such as cardiomyopathy, heart failure can occur. A, you can remember, again we have seen anxiety, depression can occur. M, you can remember mesenteric arterial occlusion can occur. P is pain, that is a common side effect, that is headache or back pain, and even abdominal pain can occur. Again, R, we have talked about this trick. R is that it is contraindicated in severe renal impairment. Then O is, it's a oral drug given 2 tablets, 333 milligram, that is thrice a day. S is again suicidality, again it can increase. A is amnesia, you can also remember confusion. T is thrombophlebitis, that is deep thrombophlebitis. And E is, again it should be given when the person stops end of alcohol consumption, then you should give acamprosate. So again, just a simple trick to understand or remember some of the important points related to acamprosate. Now let's talk about the second drug again, which is shown to have modest effect with alcohol-related disorder in the rehabilitation, that is naltrexone. So again, naltrexone is a very important drug. You will see many times very commonly used in clinical practice, and also questions may come from drugs such as naltrexone as well. So let's talk about naltrexone. Again, we know naltrexone, it is a opioid mu antagonist. It's a long-acting drug, and again we'll talk about what is the role. So it decreases activity in the ventral tegmental reward area. So we'll talk about that. So again, when we've discussed the basics, we've talked about how opioid receptors again are affecting the reward circuit. It also decreases rewarding effect of drinking, and also decreases the craving. When we talked about in the basics, so let's come back to this reward circuit. And we know that the opioid neurons coming from the arcuate nucleus, they affect both the GABA interneurons as well as they also affect the PFC glutamate neurons. So basically, naltrexone, what does naltrexone do? It basically blocks the pleasurable effects of alcohol, which are basically mediated by these mu receptors. So it blocks these mu receptors on the PFC glutamate neurons as well as from the arcuate nucleus, and subsequently it decreases the pleasure of alcohol, decreases rewarding effect, decreases also the craving. So this is how it is acting on the reward circuit. Now again, it has been seen in various studies, and one study you can remember, that is combined study, which is combined pharmacotherapies and behavioral interventions. Again, that has shown that yes, naltrexone, it improves clinical outcomes. Again, in fact, other studies have shown that it has 15 to 20% better outcome than placebo. So again, similar to what we have learned in acamprosate as well. So again, studies have shown that yes, it has a better outcome when we compare it with placebo. Now let's talk about the dosing. Now the dose of naltrexone is 50 milligram per day. Now, in fact, in many places, such as UK, it is again recommended that it should be started with 25 milligram per day, and subsequently for the first 2 days, and then it should be increased to 50 milligram per day. So basically to check for side effects, and in fact some of the GI side effects are very common with the naltrexone. So initially it is given at low doses for 2 days, and then it can be increased to 50 milligram a day. Now, before we start naltrexone in any patient, one should evaluate the possible opioid use. It's very important because many times patient may also have comorbid opioid use as well. And if a patient is taking opioid and you give naltrexone, we can precipitate withdrawals. So it's very important to evaluate for opioid use and also to monitor liver function test. Again, liver function test is very important. We'll talk about that. And on follow-up as well, it is important to monitor LFTs periodically. Now again, if you see, again when we talk about liver and renal, in which severe disease it should be not given, again we will use the same trick which we applied to acamprosate. Again, see, it has both L and R in the name, and which is coming first? It is L, that is liver. So again, in severe liver disease, one should not give naltrexone. Again, we'll talk about that. Now again, it can be started when the patient is consuming alcohol or in the withdrawal phase. So again, it can be started even when the patient is consuming alcohol. And the duration, when we talk about the duration, again according to NICE guidelines, it can be given for 6 months or longer. Again, patients who perceive that there is benefit and they wish to continue. Again, as we have discussed with the acamprosate, it should be stopped in patients who continue to drink for 4 to 6 weeks after starting the drug. Then those patients you should stop. Again, in the STG guidelines by Ministry of Health and Family Welfare, the duration is 1 year. So again, you can remember these two important guidelines which are telling about the duration. Now let's talk about another important way of giving. So one is oral. There is another way, another FDA approved way of giving naltrexone, which is through injectables, which is through injections or depot. So it is basically 380 milligram once a month depot injections which are given, and more steady release of naltrexone is seen, and especially useful in patients who are non-compliant to the treatment. So again, depot injections are also there. Now let's talk about some common side effects. Some of the common side effects, in fact, many of the patient may come with the abdominal or GI side effects such as nausea, abdominal pain, constipation. Then other side effects such as dizziness, headache, anxiety, fatigue, that can also be seen. Some of the serious adverse reactions which can occur, again very important, it can precipitate severe withdrawal in patients who are dependent on opioids. So it's very important to take or evaluate for opioid use. Hepatotoxicity again can be seen, usually uncommon at usual doses, but again one should be careful. And again, for pregnancy, it is a category C drug. For precautions, anybody having other hepatic disease, even in renal impairment, or there is any history of suicide attempt, again one should be careful. Also, if opioid analgesic is required, so in any patient who requires opioid analgesic, again be precautious for using naltrexone, because naltrexone is an opioid antagonist. So what it will do is larger doses of the analgesic will be required. Also, respiratory depression may be deeper and more prolonged in such patients. So again, one should be very cautious. Try to avoid using it when you see that patient also may require opioid analgesics. Now, contraindication, some of the important contraindication. First is currently using opioids or in opioid withdrawal, you should not give. Very clear, we have talked about this. Again, if there is any anticipated need for opioid analgesic, those patients also. If you feel that patient may require an opioid, so patient is having some trauma or underwent some surgery, and you feel that there may be a possibility, then in those patients one should not give naltrexone. And also, as we talked about, so which is coming first? L, liver. So in any acute hepatitis or liver failure, it should be avoid, it should not be given, it is contraindicated. So these are some important contraindications. Now, also some drug interaction. One is opioid analgesic. We have talked about this because it blocks the action of these analgesics. Also for yohimbine, again not commonly used drug, but again one drug interaction you may remember, use with naltrexone increases the negative drug effects. So again, these are the two drug interactions which you can remember for naltrexone. Now, there is one very interesting gene variation which is related with naltrexone. So, a gene variation, that is ASN40 ASP location in the gene for mu opioid receptor, that is OPRM1 receptor. It is seen if patient has these variation, patient will have better outcomes. So, better alcohol use disorder outcome is seen when we give naltrexone. So, this is one genetic variation which you can remember, which is favorable for the effect. Now, again, let's talk about some predictors. Again, these predictors are from Lowenson and Ruiz. So some of the predictors, as mentioned there, we are talking about that. Many times also, when you're clinically seeing the patient, some of these predictors may help you choose, the drug. So some of the predictors which shows good therapeutic responses, if there is a high level of craving is something which the patient is reporting, which is one of the important factors for relapse. In those patients, it is shown to have good outcome. Family history of alcoholism, again you see there we talked about that no family history was favorable. Here, if there is a family history, and again you can see there is some genetic involvement as well, as we talked about, genetic variation. So some genetic commonality may be there. And medication adherence, if we see that patient is adherent to medication, again it has a good response. While some of the predictors which are showing lack of therapeutic response, one is if there is high severity of alcohol dependence in those patients, it is showing less response, and presence of significant medication related side effects. Again, especially side effects such as GI side effects, again commonly seen with naltrexone. Again, in those patients also we see that there will be lack of therapeutic response. So these are some predictors which you can remember. Again, let's just remember some of the important these effects related with naltrexone with the mnemonic from the name itself. So let's talk about that. Again, it becomes very easy for you to remember when you remember it like this. So again, N is nausea, so this is again common side effect. A is abdominal pain, and again you can also remember constipation, again related with GI side effect. L, as we have discussed, liver, it is in severe liver disease, it is contraindicated. Then T, you can remember it is taken orally once a day. R, even in renal impairment, one should be cautious, as we have discussed. Then other E is it decreases energy, so there is fatigue. Now, again you can remember this. X, you can remember, that is it should not be given, so contraindicated in current opioid use and if there is a need for opioid analgesic. And any, you can remember, needle, that is it can also be given in the depot preparation through IM route. So these are some important points about naltrexone which you can remember from the word naltrexone only. Now, when we talk about these two drugs, again these two drugs, they are FDA approved, they decrease craving for alcohol, and again some studies have shown that a combination of acamprosate and naltrexone may be more effective than either of them alone. But again, this is just shown in some studies, some agree and some does not show such evidence. So again, further research may be required for it to be a common practice to give them in a combined form. But again, you can remember that yes, some studies have shown that combination may be more effective. Again, such points you can remember, especially if you are preparing for any entrance exam, again such points can be asked. Now, So let's talk about some other agents. So we've talked about two important approved agents which have also been approved by FDA. That is Acamprosate and Naltrexone. Some of the other drugs which can be used, and many of these drugs also decrease craving. So you can remember it with this mnemonic. The mnemonic is alcohol, not a best friend. So if you tell the patient alcohol is not your best friend. So let's talk about some of these important drugs. Again, you will find the mention of these drugs in the latest CTP, Kaplan and SEDOC. So again, one should note that yes, some of the other drugs, although they're not FDA approved, but they have been, studies which have shown that there is some positive outcome with these drugs. Now, so first two we know, A for alcohol, A for acamprosate, and N is naltrexone. These two drugs we have discussed. O is ondansetron. Ondansetron basically is a 5-HT3 antagonist, and the dosage again very less dose, that is 4 microgram per kg body weight. It is shown that it is used, and especially in patients with early onset alcohol use disorder with comorbid drug dependence and criminality, especially in those patients, it may have a even better result. So one is ondansetron. Now next is T. T is topiramate. Again, topiramate is an anti-epileptic drug, used in neurology. Again, it has multiple actions. It is a GABA boosting agent. It also blocks the glutamate receptor. It also affects dopamine. So again, it has multiple actions, and usually 300 milligram per day is the dose which may be used. So many times you will see in practice that many times psychiatrists use some of these drugs, and we have seen that they may be useful for many of the patients. So T, so NOT, T is topiramate. Then B for best, B for baclofen. Again, baclofen also is shown to be useful, and many times you will see that many of the psychiatrists are using baclofen, and in fact even you will see some of the pharma people as well, they would come to you with the baclofen having effects on alcohol craving. Yes, so baclofen may sometimes be used. It is a GABA B agonist, and up to 30 milligram per day may be used for alcohol use disorder. And F is fluoxetine, in fact SSRIs and even sertraline. So fluoxetine may be used somewhere between 40 to 80 milligram per day again, and even sertraline may also be used. And in fact, it is seen that there is some evidence that the SS genotype in the promoter region of the serotonin transporter gene may be more likely to respond with some of these SSRIs. So again, SSRIs may also be used, and many times you'll see that patient, if having other issues such as anxiety, depression, we may also use these SSRIs such as fluoxetine. So we'll have an added advantage. So these can be used. So these are some of the agents which may be used in alcohol use disorder.